From CBS 4, this is Haystack TV, powered by HaystackColorado.com. Finding reliable services can be like finding a needle in a haystack. With HaystackColorado.com, finding the needle just got a lot easier. Now, the host of Haystack TV, Chris Kane.
Welcome to this Haystack TV Spotlight. If you've tried everything but still can't get rid of back, shoulder, or neck pain, Dr. Paul Burns of the Spine Center can help. He's an expert at spinal decompression and manipulation under anesthesia. Dr. Burns has 28 years of experience. He is board certified in chiropractic, sports medicine, and manipulation under anesthesia, and the Spine Center is a BBB accredited business with an A+ rating. Dr. Paul Burns of the Spine Center joins us today. Thanks for being here.
Thank you for having me.
Now, this is pretty exciting. Manipulation under anesthesia. Explain what that is and how it works.
Well, manipulation under anesthesia is pretty much just what it sounds like. We use a series of gentle spinal manipulations and passive stretches to break up scar tissue and adhesions in the back, neck, and other peripheral joints while the patient is under twilight sedation.
And do you do this in a hospital setting or in your office environment?
No, we don't do it in the office. We can do it in a hospital. However, I use ambulatory surgery centers throughout the Denver metro area where I have a team of specialized physicians that work with me to do the MUA.
And people are, I'm sure, wondering, is it safe?
Of course it's safe. Like anything, there can be complications. However, we go through a very stringent and specific criteria for each patient to make sure they're a good candidate for MUA.
And who would be a good candidate then for MUA or manipulation under anesthesia?
Well, a good candidate for MUA would be anybody that has chronic neck, back, shoulder, or other joint pain, restricted ranges of motion, and what have you.
And what about some of the most common conditions that you see or treat with MUA?
Well, the most common conditions will be bulging discs, herniated discs, degenerative joint disease, degenerative disc disease, fibromyalgia, frozen shoulder, failed back surgery. In fact, a good number of our patients are referred, in fact, most of our patients are referred by other chiropractors, orthopedic and spine surgeons who have patients that have not responded well to conservative care. The reason for that is if we don't break up the scar tissue and we don't break up these adhesions, you still have restricted ranges of motion, which eventually are going to cause the pain to come back.
You know, that's a really good point. So people that have gone through the process already and haven't had success, or not, I guess not the manipulation under anesthesia process, but others, this might be the next alternative for them or the next step for them.
Exactly. I mean, it's a good first step in people that have had chronic conditions and know about it, but unfortunately, other than on the East Coast, manipulation under anesthesia is relatively unknown in the West. And so generally, these patients have already been through a series of chiropractic, physical therapy, epidural steroid injections, even surgery or spinal decompression. And all of these things combined are great and give them short-term relief, but they can't maintain that pain relief long-term because they still have adhesions and restricted motion. And
quickly, can you tell us about spinal decompression, because you do that also?
Right. We do spinal decompression in the office as well, and it's an excellent way of treating neck and back pain from degenerative discs, bulging discs, spinal stenosis, what have you. But the difference is, in fact, a lot of the patients we see in the office for manipulation under anesthesia have already had spinal decompression. So spinal decompression works really well in those situations where there's not a lot of adhesion or scar tissue or long-term chronic disease. But when you do, we really need to do the MUA, because if you don't break up the scar tissue and the adhesions, there's absolutely no way you're going to be able to maintain pain-free ranges of motion.
And which procedure is better?
Well, neither one is really better. It depends on the candidate. Depending on the candidate, we may do MUA followed by spinal decompression. We may do a manipulation under anesthesia with joint injection. I mean, each patient is an individual, and we handle each one individually.
And that's a great point. Thank you so much for being here. Great information. I know you have a special offer. I'm going to tell our viewers what that is and how to get a hold of you. If you suffer from back, neck, or shoulder pain, you want to contact Dr. Paul Burns. His practice is located in the Denver Tech Center. Call the Spine Center at 303-694-9759 or visit their website, drpaulburns.com. Mention Haystack and receive a free, no-obligation consultation. And additionally, the first 15 callers right now that are appropriate candidates will get 60% off the price of spinal decompression therapy. The number again is 303-694-9759. The Spine Center paid for this segment.